So symptoms of PMDD include depressed mood, anxiety, irritability, feelings of being keyed up or on edge, and mood swings. Can also cause decreased interest in usual activities, difficulty with concentrating, feeling fatigued, and changes to appetite. And there's also a few physical symptoms associated with it, such as breast tenderness or swelling, and joint or muscle pain, bloating, and weight gain. So for a diagnosis of PMDD, it's normally a collection of the sort of earlier mentioned symptoms and a few of the later ones. But this is not a sort of exhaustive list. A lot of people experience slightly different symptoms, and some have greater impact than others. It's still a condition we're very much learning about, and so even though it might not be included on this list, it might be something that you experience during this time if you do have PMDD. So what makes PMDD unique and difficult to diagnose a lot of the time, and I don't know why, I'm hoping my slides aren't funny on your screen, but they are a little bit on mine. So what makes PMDD slightly difficult to study compared to other mood disorders is that symptoms of PMDD arise within the luteal phase, so a week or two before menstrual bleeding, which, sorry, I completely lost my train of thought.
Thank you.
Yeah, so these symptoms arise during the week before the period and they subside during menstruation. In order to be diagnosed with PMDD, you need, or as the DSM-5, which is one specific diagnostic manual, specifies that to be diagnosed, you have to record daily symptoms alongside stages of the period for at least 2 symptomatic cycles. And by comparing these symptoms, we can see how during these stages, we can see how symptoms worsen in the luteal phase and get a little bit better or improve during the other stages of their cycle. So that allows us to confirm it's a PMDD diagnosis. For some, symptoms may persist outside of the luteal phase, and this is classified as premenstrual exacerbation. So it's not a formal term necessary, as in it's not been added to a diagnostic manual at the moment, but premenstrual exacerbation refers to the worsening of symptoms of a pre-existing mood disorder as a result of this hormonal fluctuation that we see in the menstrual cycle. So for example, if you have depression, you may feel particularly worse during the week before the period, but this depressive symptoms continue throughout. So it's slightly different than PMDD. This is because the DSM-5, so the diagnostic manual that we use at the moment, specifies that PMDD symptoms should not be an exacerbation or a worsening or other disorders such as depression, anxiety, or personality disorders. There's not a lot of research on this at the moment, but it can actually give us really good insights in the interaction between, I put gonadal steroids, I should just put hormones as better wording, but hormones and psychiatric conditions, because we know that they have an effect in PMDD, obviously, but in other conditions also. So how prevalent is PMDD? As I sort of mentioned earlier, the number of people that is estimated to be affected by PMDD is about 1.5 to 5% of people with a menstrual cycle. It's a really big and confusing range, and this kind of comes down to inconsistent methods used in the research at the moment. So a lot of the time, they do not use the prospective mood monitoring that's required to diagnose PMDD. So people who have other conditions or experience PME are getting mixed up in this. So it's kind of made a little bit more confusing of how many are affected and what it kind of classifies under. More recently, it's sort of looking like it's the prevalence of 1.6. So it might be a little bit rarer than we initially thought. However, that research in itself also was a little had some limitations. So the main takeaway is research is crucial in sort of understanding how many people are affected by this condition. And yeah, that's why we need people to take part. Regardless of prevalence, however, PMDD has a substantial impact. People with a menstrual cycle experience approximately 450 periods in a lifetime. So it's a chronic disorder. 30% of people with PMDD attempt suicide and 72% experience suicidal ideation. So the impact on life is huge. And a lot of the time, this is sort of overlooked and undervalued, whereas the numbers are staggering. So yeah, limited understandings of the causes of PMDD contributes to the low effectiveness of treatments and means that many people are going without symptom relief. Sorry. So the causes of PMDD, as I sort of mentioned, it sort of remains unclear. There's multiple reasons for this, partially because it's such a complex condition to study, because we need this sort of prospective mood monitoring to kind of have a good comparison. What's sort of been sort of continuously considered between researchers is that it's highly suspected that it's the sensitivity in the brain to normal fluctuations of the menstrual cycle. So there's not abnormal hormonal levels. It is the typical fluctuation in progesterone and estrogen that we see. However, there is a reaction to this at a brain level, which we don't really know why. And it's not that we have no idea, it's just there's multiple ideas and we don't know how they work together. So it seems likely that it's a combination of multiple things, such as genetic susceptibility, increased brain metabolites to progesterone, which is the hormone that we see changing in the luteal phase quite substantially, neuroinflammation and differences in brain structures and functioning, and differences in estrogen and serotonin interactions also. So it kind of implies there's this interplay between social and environmental factors, as well as biological mediators, and looking at comorbid or co-current diagnoses such as physical conditions or other psychiatric disorders or neurodiversity could help understand this a little bit better. So there's a lot of research going on at the moment and a lot of ideas. However, we've not really worked out exactly how they fit together, but it's not that we don't know at all yet. So it's moving in the right direction. In terms of treatments, there's a wealth of treatments at the moment. I would say if you want to do some homework or some wider reading, there has been a recent treatment guideline put together by the American College of Obstetricians and Gynecologists, and they sort of look at the different recommendations and they rate them based on the evidence that's surrounding them and the effectiveness that they've seen. So I can put a link into that if you want to have a nosy yourself, but they explain this all a little bit better. But as we don't understand the exact causes, we don't necessarily know the exact treatment plans. So the first approach a lot of the time is to treat the mood symptoms themselves. So SSRIs, antidepressants, are widely used because they address the mood symptoms of the disorder. These symptoms are quite similar to depression and anxiety. So it's kind of, we see this works with them. So let's try it with people with PMDD. So this is why SSRIs are often proposed as the first line of treatment. What's quite unique about PMDD is that SSRIs that are prescribed intermittently, so like during the luteal phase only, seem to be as effective as continuous SSRIs. The understanding of how this works is not fully established, but it kind of gives us a bit of an insight into what's causing PMDD and how we can best treat it. So yeah, you might hear some people going on to intermittent dosing for PMDD, and it has actually been shown to be widely effective, even though it's not used in other diagnoses. Psychological interventions have not been massively looked into, but are becoming more of a focus. And again, they've been really successful in supporting people with PMDD, and psychoeducation and group therapies. Oh, my camera's freezing. Have also shown to be really useful. The alternative approach, rather than looking at the mood symptoms themselves, is looking at the hormonal fluctuations that seem to be responsible for the change in these symptoms. So you see hormonal contraceptions being often recommended. So they're meant to alleviate sort of drastic increase in drop in progesterone and estrogen that happens in a typical hormonal cycle. trying to ease them. The most commonly researched is the droseparenone. It's written there, I can never pronounce it quite right. Containing pill, but is the only one that's had a randomized controlled trial looking at effectiveness of it in PMDD, and it has been shown to have less side effects. But it's a really complex issue looking at contraceptives because they also have been linked to mood symptoms themselves. So it's kind of a case of trying and working out what fits best for, which I'm sure many of you who've experienced PMDD might have also experienced yourselves. A sort of later stage recommendation is chemical menopause. So again, this is the sort of approach of ceasing all hormonal fluctuations by suppressing ovulation in this case. Chemical menopause, which I explained better on here, is not considered a long-term treatment. It's meant to be a sort of preliminary step before looking into surgical options. There are massive side effects with it in the sense that it is inducing menopause. So menopausal symptoms such as vasomotor symptoms, so the hot flashes and things like that you see, and bone demineralization can be seen when inducing someone in a menopausal state. So these are things to consider when recommending it. And sort of after a long period of having successful treatment, like unsuccessful treatments and difficulties with other therapies, a lot of people, well, not a lot of people, sorry, some people opt to go through surgery, so bilateral oophorectomy and hysterectomy. There is really limited research on this at the moment. A lot of these studies are quite old, and there's not been a lot of like long-term follow-up. So I know for me personally, this is something that I'm really interested in. I hope that a lot more research is going to go into this in the future. I can try and contribute in some kind of way, because it is obviously irreversible and has a huge impact with all the other symptoms that it can bring on with menopause. So it's things to consider. Yeah. I don't know if you can hear all the bibbing when my thingy goes off. I apologise if you do. I don't know how to turn it down. Anyway, I talk about in all of these talks a lot about how under-researched PMDD is, and it's a bit, it's a bit negative. There has been a really positive shift as of recently. So PMDD only got recognised by the Diagnostic Manual in 2013, and it also got introduced to the International Diagnostic Manual in 2019. So it's fairly new in terms of being recognised as a condition. However, research has kind of existed for a long time before. So terminology such as premenstrual syndrome or premenstrual tension has been around for a while, but for it to be like officially recognised as new. Since the introduction of these diagnoses in these manuals, there's been this massive influx in research, and it's starting to be really good research. So although we don't know a lot now, hopefully we'll know a lot in a year or two's time. Even for me personally, in the last 3 years of researching this, the amount of conversation that's been happening and people attending things like this has rose massively. So that's brilliant. So what we're doing, PREDICT stands for premenstrual dysphoric disorder, indicated causes and triggers, and it's a online study where we're asking people to take part because we're trying to build the biggest cohort of people with lived experience of PMDD symptoms or PMS in the UK. So we are hoping that from this, because we invite people to give genetic samples also, we can better understand how genetic environmental factors can help us identify individuals at risk. And we want to contribute positively, hopefully, to the diagnosis, prevention, treatment, and support for people experiencing PMDD. What our project actually involves to taking part, we ask people to take part in our online survey. So we ask a bunch of questions about your symptoms, experience of diagnosis, treatments, and it takes about 20 to 25 minutes to complete. We then ask a subset of people to take part in a 2-month mood diary, so tracking symptoms. However, this is entirely optional. You can take part in the first bit and not listen to any of my future annoying emails about the other part. But yeah, these are optional branches. So the mood diary is an optional part too, and we literally just post it. Well, I post it to your house with an anonymized ID on it, and you return it in an envelope with no personal details on. So it just comes back to us, and again, the IDs are completely anonymized, so it should be super secure. I can also send back copies of diaries if you want to have them for the GP and whatnot. And then also a subset are invited to give a genetic sample. So similar thing, we send out a spit kit in the post with an anonymised ID on it and a return envelope. You just spit in the tube and send it back to us. And we can look into a lot of things as a result of that, because genetics don't change across the lifespan. It means people have gone through treatment or menopause. We can learn a lot about. So it's a really exciting and useful way, and it can help us understand a little bit more about how PMDD may differ from other diagnoses, or maybe what if there's any risk factors or any links to do with that. And how it's looking so far. So we have 1,223 participants, which is incredible, and we're hoping to grow more. And 153 genetic samples. This is a little bit low, and I think for a lot of people, it's about taking part in that and sending it back can be a bit of a limitation. But it is super simple, and if it sits on the side for months at a time and then one day you randomly remember you need to pop it back in the post, that's still great. We can still use it. So yeah, it's that's kind of where we got with that. And the mood diaries also. So again, it's a massive ask to ask people to take part for 2 months, but people who have done a really great uptake, and 59 is really amazing. So very grateful for the people who've taken part so far. And lastly, this is just, I don't want the volume paying. We have a little animation online that I will share in the chat that's like a nice way of summarizing what PMDD is. And I will also put in the chat about how to take part and you can scan this QR code here. And happy to answer any questions. I will let somebody else talk now because I feel like I've been talking for ages. So
thanks so much, Chloe. That was brilliant. We've had a few questions in the chat, but so we can keep things moving, I wonder if you could maybe have a little read of those and maybe respond in the chat for us, if appropriate. Because next I'd like to introduce Phoebe Williams. She is the founder of the PMDD Project, and she's going to talk to us about her own experience. I'm going to run through some of the questions that we've received in the run-up to the webinar. We've had some really great ones so far. So starting with a nice easy one, for both of you, I guess, what does the future of PMDD look like? Is it getting better?
I would say from a research perspective, it definitely looks that way. People are talking about it more, and there's amazing charities like Phoebe's popping up, some more conversations happening, people learning a lot more about it. And because, as you sort of mentioned, Phoebe, like the prevalence, we're only receiving information on how many people have it based on people that know, like, and take part in research. I think with more education, people learning and being able to identify it within themselves, it gets relayed back to us and we have a better understanding in that. So it definitely seems like it's moving in a more positive direction.
Yeah, I'd agree as well. I think we are a very long way off getting to where we deserve to be, the PMDD community deserve to be. But I think even in the past couple of years, you'll start seeing and hearing about PMDD. There's more noise around it, and people are talking about it in the media, and people are picking up on it and recognising that it's a condition that needs to be taken seriously. So I think, someone's just said Emmerdale, definitely. There was someone talked on it on Emmerdale or Married at First Sight, if anyone saw that, and Vicky Patterson talks about it a lot, and I think people are starting to go, actually, for a long time we've sort of suffered in silence because we've gone, well, it's a period, we're lucky to experience periods, it should be a natural thing, so we should just put up with it. But actually this isn't normal and you shouldn't put up with it, and if it's getting to the point where you don't recognise yourself every month, that's not normal. So I think we're definitely further than we were. I think I always see like menopause as the blueprint of women's health conditions in terms of the awareness that they now have, whilst it's not perfect, is where we want to be. We want everyone to know what PMDD is without having to explain it. We want people to start feeling comfortable with talking about it, because there's still that taboo. So we're a long way off, but we are definitely getting there, and it's definitely looking positive for the community.
Fantastic. Yeah, and there's lots of people in the chat asking if they can get involved with the charity. So are there any ways that come to mind at the moment, Phoebe, that people can get involved?
Definitely. So at the moment, we're all volunteer led. So I am doing this alongside a full-time job, and so is all of our other amazing volunteers. So we need all hands on deck, please. So we have different ways in which people can get involved, whether that be through fundraising or whether that be through policy and advocacy. I will share my email in this chat, so if anyone does want to find out more information about volunteering opportunities, then I'd be more than happy to share them. Yeah.
Thanks, Phoebe. So our next question really was kind of part of this overwhelming response that we had about people feeling a little bit misunderstood or even dismissed by health professionals. So how would you recommend that people go about getting a diagnosis, or at least kind of looking into this?
Shall I start?
Yeah, sorry, I'm still replying to one of the comments. And
oh
trying
no,
to
that's
find a
fine.
helpful
I will go.
thing. Yeah.
I'll go. So it is really hard to get a diagnosis, and it is taking on average 12 years. So I think Chloe mentioned this earlier. You've got to advocate for yourself, and you do have to stand up and sort of take leadership in the doctor's room. Again, we've got a resource on our website that talks about how to get that diagnosis, how to take ownership in the doctor's room, because it's difficult. You've got 15 minutes in the doctor's room, and in those 15 minutes, you've got to articulate either how you're feeling in that exact moment in time, which if you've got PMDD, you know, the brain fog all too well makes it difficult to actually articulate how you're feeling. But if you're not in the luteal phase and you feel happy and you feel like you, then you kind of like, there's nothing wrong with me, I'm fine. So you've got 15 minutes to really sell the way this condition is taking over your life. And to do that, I really recommend tracking your cycle for 2 to 3 months. And not just in the luteal phase, every single day of your cycle, because then the doctors can see that there is a pattern and it's based on your cycle, and they can see how severe these symptoms are as well, because these symptoms that you're experiencing, more often than not, you don't experience at all outside of the luteal phase. I also really recommend asking for 2nd, 3rd, 4th, 15th opinions, speaking to as many specialists as you can, gynecologists, endocrinologists. And if you can take someone with you into the doctor's room, I recommend that too, because their perspective actually has a huge impact, and can really make a real difference in just reinforcing the impact it's making. Take as many resources with you as possible. We do have guides for healthcare professionals on our website, which I keep harping on about, sorry, but we do have guides on our website for GPs specifically. So if you can somehow email your GP prior to your appointment, give them the opportunity to read up on PMDD, it gives you the opportunity to just have a better 15-minute chat than I know far too many people who have gone in the doctor's room and the doctor's sat there and Googled PMDD. That's not what you want. So just be as resourceful as possible.
Amazing. Phoebe, like some people in the chat have asked, I'm not muted, am I? About
Yes.
if there's a specific template. We have one that is part of our project, but you can access the PDF online, and I know there's other ones online.
Yeah.
But did you have one as well?
We don't have one, but what we always recommend is, I'm going to post it in the chat now. I mean, definitely go with yours as well, but this one here is, a free resource, and it's a symptom mapper and a period tracker as well, because I think some people have found that some of the obvious apps that come to mind don't really counter for extreme conditions or abnormal cycles as well. Mine's an abnormal cycle and it doesn't really work for me, so these ones are brilliant.
Yeah. There's not any that I know. There's been like the development we were trying to work on it ourselves, but it's quite tricky, of a few different apps, but there's none that's specifically that come to mind at the moment. But I know IAPMD also have like an online tracker, they have an app, but I don't think it's working great at the moment. But they have a one that you can copy as well and print off, which is really useful. I think Julia popped ours in the chat.
Yeah. Brilliant, brilliant. So the next question then, I guess, is more targeted toward Phoebe. So people are talking about having PMDD, but also having all of these other responsibilities. How do you navigate having a career, but also the symptoms that come with having such a severe kind of clinical disorder?
Yeah, it's really, really hard. And I kind of consider myself relatively lucky because it definitely affects my impact to work, but I know people that just can't work, they can't show up, and it depends what line of work you're in as well. I'm lucky to work from home, so that brings a lot of benefits for my symptoms in particular. But in terms of coping in the workplace, and maintaining your career whilst having and navigating PMDD, I think the most important step is education. So you might not be comfortable communicating your needs or what PMDD is to your manager or to your colleagues, but that's what we're here to do. We can go into the workplace and we can educate your staff, your colleagues, your HR leaders on what PMDD is and the accommodations that are available should you need them. Communicating is really important. I know it's really hard, but if you've got a support network, if you've got a colleague or a peer that you can confide in, and just let them know sort of triggers for you. You might find presenting really overwhelming and anxiety provoking. Let them know that, and just let them know that you're going to be a little bit quiet for a week or two of every month, and that's fine. You're doing the admin, you're still showing up. I always plan my month in advance. So when I know my luteal phase is going to come, I will plan my work schedule in advance. I'm lucky enough to do that. Some people can't, but I'll plan the meetings, I'll plan the presentations, I'll plan the stuff where I'm public facing and I literally can't string a sentence together. I'll plan them into when I'm not feeling luteal, and in my luteal I'll just be doing admin stuff. I'll be doing stuff to get through. A lot of people always come to us about being a parent as well and coping as a parent with PMDD, and that is a huge struggle for so many people. I don't have children, so I can't say it from firsthand, but my mum had PMDD, and I speak to people all the time who have PMDD and children, and it's hard. Again, communication is key. I think the younger we educate children on PMDD and menstrual health as a whole, women's health as a whole, the more equipped they are, the more able the more empathy they will have as well. But if you give them the tools and give them the language and make it a safe space, not an awkward conversation, then they're only gonna return with empathy. I also really recommend providing or creating a luteal phase toolkit for your children. So when it gets too much and you just need to hide away, you need to close your eyes, you need to just have 5 minutes peace, have a little toolkit ready so that they can get their colouring books out, they can get whatever it is that entertains them and keeps them busy for half an hour, and it's just a saviour. Even that half an hour will just give you that time back to just reset. But yeah, I'd say they're the main tips.
Thanks, Phoebe. So the next question is for Chloe. So Chloe, is there a link between PMDD and attention deficit hyperactivity disorder, ADHD?
So it's a really interesting one. It's an area that's coming up a lot more, and it's becoming a research priority a lot more at the moment. Obviously, knowledge of PMDD alone is quite minimal in comparison to other disorders. And then with ASD and ADHD in girls, it's also quite under-researched. Again, this is all changing in the right direction, but as it stands at the moment, not so much. I think the limited amount of research there is out there at the moment, there has been shown, I have got the numbers in front of me. So in some of the samples, they found like 30 to 40% of people in an ADHD cohort did have PMDD. So there's a potential for a link there. And again, this is inspiring more research. But these PMDD diagnoses were provisional, so they weren't made with tracking or anything like that. So it's kind of like we're at the early stages of looking into it, and it's something we also record in our study and we hope to look at, because it definitely seems relevant, especially when you take into that there's some sort of brain reaction to the hormones. So yeah, we don't quite know, but it seems like it's something that's definitely worth looking into.
Okay, thanks, Chloe. Coming right back to you now with a question about drugs. So you talked a little bit about the current treatments and therapies that people are trying for PMDD, but what evidence is there to support the use of SSRIs in particular, either as a daily sort of dosage throughout the month or during that luteal phase?
So it's one of the more common treatments that I think is recommended. It tends to be the first jump. Often that's because they look at similarities between symptoms of PMDD and depression. So looking at PMDD specifically, there's not a massive amount of research, but it seems to be quite effective. So there's studies in 2024 and ones that date back quite a while ago now that have shown that it does help alleviate the symptoms that arise in the luteal phase. And yeah, we see really uniquely in cases of PMDD, there seems to be this like rapid uptake in effectiveness of SSRIs in this group, which kind of indicates that there's some sort of serotonergic mechanism going on, which may be why people experience PMDD in the first place. But yeah, there is a lot of literature on it, and it seems to be sort of the first suggestion for a lot of people. I don't know if Phoebe, that's sort of what you've seen as well, where people tend to be recommended this as an option first. But yeah, it would be fantastic if there's hopefully there's going to be a growth more in PMDD specific treatments rather than sort of like taking things from depression, anxiety and sort of applying it to this group, because it is obviously different. But yeah, it seems to be a positive one so far.
Fab. Okay, thank you. I've just seen a question about if this has been recorded. Just to say, it is being recorded, and we will share it on our NCMH YouTube channel after the webinar is finished. May take a couple of days or so to get that live. Another question that we had, and I'm going to kind of open this to the chat now as well. Are there any holistic methods, tips, tricks that people have tried that have found that have really helped them? Phoebe, I don't know, you've given us already quite a few kind of ways that you manage.
Yeah, I mean, someone mentioned before saffron, and I've heard good things about saffron for some people. Again, everything that I'm about to say or recommend is it's not one size fits all. It's not going to work for everyone. It's trial and error, unfortunately. But saffron, I've heard really good things. Antihistamines has been, in the news at the moment, or not in the news, but on my algorithms anyway, as being really beneficial for people with PMDD. For me, cutting out caffeine is key. I'm a girl who loves a coffee, but during the luteal phase, it just does not agree with me and makes me incredibly anxious. And I suffer really badly with insomnia and extreme fatigue during the luteal phase. So caffeine is not the answer for that. So I've noticed a huge difference in cutting that out, as well as sugars and alcohol. As well, I think there's so much power in supplements. Now, with that, so magnesium, iron, vitamin B6, magnesium in particular is brilliant for reducing anxiety, but also sleep hygiene, or improving sleep hygiene. But that's also to say to be super mindful of any fads that are going on out there as well, because it's just you want to make sure that what you're putting in your body is right for you, and it's true to what you need. And the final one, I suppose, is exercise, but I don't just mean any old exercise. I mean being really careful about the way in which you exercise. So I'm not a runner, I'm not a cardio person at all, and I'd always feel a bit rubbish doing yoga because I wasn't very good at it. So I'd just stick to strength training, when actually I realised that was making my symptoms worse during the luteal phase, because I was overexerting my body and I was consuming so much, using so much energy by doing strength training. Now I've sort of changed my way of exercising. So I'll strength train in my follicular phase when I'm feeling fantastic. And then when I'm in the luteal phase, I will be gentle with myself, and I'll accept that my body just can't handle that level of stress. So I've got into Pilates, I've got into long, nice walks, and that's made a huge difference for my body. So yeah.
Brilliant. Yeah, we've got some people in the chat saying that saffron is the best supplement I've taken. Herbal tea helps to calm me down, and eating lots of protein. Barbara said that her daughter saw a herbalist for her PMDD, and the herbal prescription was so invaluable. We've had a question about the role of hypnotherapy, whether that might help with PMDD. I mean, I haven't tried hypnotherapy myself. I don't know whether either of you have from experience.
I haven't and can't say too much about it, but I do know, and this kind of relates back to one of the answers that I just provided to a question, but there is a huge link to trauma and PMDD. So for some people, therapy is an absolute game changer because you're unpacking a lot that you need to unpack. You're unpacking issues within your life external to what's going on in the present. So hypnotherapy might be the answer for that. CBT, I've heard, is really, really useful for PMDD as well, but I don't know too much, so I don't want to advise too much on that.
Brilliant. Okay, thank you. Ruth has also said that cold water swims really help her out. I've heard a lot of good things about cold water swimming, but with the disclaimer to check conditions and swim safe. Thanks for that, Ruth. Okie dokie. We had another question from Zara. How do you track your period and what phase you're in if you don't really have any? So if somebody's on the chemical menopause.
Sorry, I'm taking this answer here. Hope you don't mind, Chloe. But I would say listen to your body. I think you wake up and you just know what your body's telling you, and it's either telling you to rest and be kind and go slow, or it's telling you, I feel really good today and I'm gonna achieve something great. Just listen to your body. You're your own advocate. You know your needs best. So, and you know, I know some people don't experience normal periods or periods at all. So it's just listening to what you need on that day.
Fab. Thank you. Barbara's also said her daughter's halfway through a CBT course, and that was very effective. Her just going back to the last question that we had before that one. Okie dokie. So we've only got 3 more minutes left of the webinar.
There was a question I just wanted to quickly answer that was in the chat.
Yeah.
Somebody asked about, because they mentioned taking part in the study so far, and about a mood diary, about taking part if they're on chemical menopause or that their symptoms are a little bit irregular. So the way that it should be set out, it's just about, just fill it in whatever days that you do. So it shouldn't say at the top, like you tick whether you're bleeding or not bleeding. You just fill it out across the 2 months rather than 2 cycles and try not to overcomplicate it. That'd be fantastic. Any information, it's brilliant. And feel free to write things down and draw all over it or do whatever way you feel. I can always send out another version as well if you want to start again or change the way you've done it. So any willingness to take part is greatly appreciated.
Brilliant. And I've just put a link to the study again in the chat.
Oh, thank you.
If anybody's lost that, because there's been so much fantastic conversations today. Yeah, so I guess we've got sort of 2 more minutes to kind of really get a point across. So if there was one thought that you wanted to leave people with today, Phoebe and Chloe, what would it be?
Chloe, do you want to go first?
A more positive note of things are moving in the right direction, and hopefully I can, like, our project can help contribute to that. But I feel like I'm constantly going on about how under-researched and stuff like that, and it is definitely moving in the right way. So it is positive, hopefully.
100%. And like, I think you guys are doing such amazing things, and I feel like everyone listening to this is going to be you've instilled hope in us all, because you're actually focusing on the PMDD community. You're trying to do better for us, and that in itself is a huge milestone. And I suppose another thing for people to take away, if anyone is struggling, if anyone resonates with what we've said today, the PMDD Project is here to listen. So we are always here to talk if you need to, here to listen to any rants you've got, a shoulder to cry on. So just make sure to check us out, but definitely get involved with the study as well, because they're doing amazing things.
Yeah, and if you want to drop us any questions, the link to our website is on here. If we've not managed to answer it today, you might be able to drop us an email. We have a specific email account which I will put in the chat which will be I'll be a bit quicker at responding to than my normal one. But yeah, feel free to drop us any questions, and I might not have the right answers, but I'll at least be able to signpost you or send you a million papers that might help you find the answer of the right people to talk to.
Yeah, thanks so much both, and thank you everybody for coming and for your invaluable contributions today. I'll just give Chloe a second to put that reproductive mental health programme email address in the chat. So I'll leave the window open for the next 5 minutes or so, so stick around if you want to get that email address. But otherwise, have a really good evening, and thanks so much for stopping by. Thanks everyone.
Bye.
Thank you.